Our last speaker for the first part of today's workshop will be Jacob Stegenga. Jacob is a reader in the Department of History and Philosophy of Science at the University of Cambridge. He's published widely on fundamental topics in reasoning and rationality and philosophical problems in medicine and biology. Prior to joining Cambridge, he taught in the United States and Canada. He received his PhD from the University of California, San Diego. He is the author of Medical Nihilism, which is a provocative read to say the least, as well as Care and Cure, an introduction to philosophy of medicine, and is currently working on a book on the sciences of sexual desire. So go ahead, take it away, Jacob.
Thank you. Am I coming through okay? Can you hear me? Yeah, great. Okay. Yeah, I would like to thank the organizers for this event, Jamie, Mike, and Vlasta. It's a very interesting and pleasant event to be part of. And I see some old friends among the speakers and the audience, and in a normal conference, we would be able to hang out and have a beer afterwards and make new friends. So we can't do that today, but I do hope that if we bump into each other at a conference sometime in the future, you'll come say hi. So in some sense, going last today makes pretty much everything I'm about to say redundant, because a lot of what I intended to say has been said by our illustrious panel. What I want to ask is, are there particular features about pandemics that motivate changes to the ways in which we might organize biomedical research, and particularly fund biomedical research? So that was one of the guiding questions for this workshop, is how are we supposed to fund pandemic science? Now, of course, as we've heard from some of our previous speakers, like Sergio, pandemic science is, of course, like a subset of medical science. And so more general answers to the question about how we ought to fund medical science should inform how we ought to fund pandemic science. But I also think that some particular lessons about how to best manage and fund pandemic science might inform that more general question: how should we manage and fund medical science? But I am going to, for like most of these few minutes, zoom in on pandemic science, asking this question on the screen. And just for like 1 minute at the end of my commentary, I'll ask some of those more general questions that Manuela and Sergio were raising. Okay, so my way of thinking about this question is to ask, what are some features about pandemics, and in particular about COVID, that make it a kind of distinctive domain, such that those distinctive features could motivate changes to status quo? One really obvious feature of COVID is just how rapidly the rate of change of disease impact was and is. So, I mean, that's in part simply because it's a highly infectious respiratory virus. So infectious diseases can spread really rapidly, and it's also a very severe virus. So the combination of infectiousness and severity of symptoms has entailed that the pace of morbidity and, of course, mortality has been astonishing. So that suggests that, like, this particular disease is not like a lot of other infectious diseases that we've dealt with, and it's certainly not like most chronic diseases that we deal with. None of that is to say that the morbidity and mortality experienced from either other infectious diseases or chronic diseases is sort of like, less serious or less important than COVID. But what's particularly impressive about COVID is just how quickly the rate of change of morbidity and mortality has been. So this is feature one that's going to motivate some kind of general reflections later. What does this feature suggest to me? It suggests that to respond to this rapid pace of change, we also we ought to have a kind of science that is ready to respond in a similarly rapid rate. Of course, we've seen rapid science during the COVID pandemic. We've seen journals get flooded with article submissions. We have journal editors, like the editor of Lancet, saying that he's hired an entire team of surge capacity editorial staff. Some of this scientific work has been good, but of course we've also seen a lot of scientific work that's been sloppy. And some of the most famous scientific studies during the COVID pandemic have been so controversial that they haven't even been published yet, like the Santa Clara seroprevalence study. So we need to respond to a pandemic like this. We need rapid science. But of course, but rapid science can be sloppy, and so we need controls on rapid science. We also have a brief window of opportunity, a brief temporal window for learning about really important features of an infectious disease like COVID. So there are many things that we want to know about the virus, like what the R value is, what the case fatality rate is. The case fatality rate has been a highly controversial parameter. Some of the models, like the Imperial College models, have assumed a particular case fatality rate, and then some epidemiologists have been criticizing that case fatality rate as being grossly exaggerated. And so what exactly that case fatality rate is informs policy in a very direct way. And so it'd be really nice to know, to have really good evidence about what the true case fatality rate is. Many people are now saying that the case fatality rate changes depending on all sorts of contextual features. And one obvious contextual feature is demographic, like age. So these are the kinds of things that we should know about as quickly as possible during a pandemic. And in part because of how quickly the pandemic spreads, and in part because of how rapidly governments deploy mitigation strategies, there is a very brief period of time for learning about the features of the virus and various mitigation strategies that we might deploy. So that feature is also going to inform some kind of general lesson that I want to draw at the end. Okay. Respiratory viruses don't respect borders, of course, no matter how hard we try to close borders, no matter how many flights are canceled. A virus like COVID doesn't stop at a political border. And so one of the guiding questions for this workshop is, should funding for pandemics like COVID should the funding be status quo? Should particular countries just care about their own particular funding interests, or should there be some more kind of global response? And the fact that the virus doesn't respect borders suggests, I think, that there ought to be a sort of scientific approach to COVID that itself is border-free. Moreover, even if a particular country is only entirely internally motivated, like some policymakers in a country say, we want to devote research resources to problems that only matter to us. This fact that respiratory viruses just spread without any regard for borders should suggest to those policymakers that in any case, they ought to be motivated to participate in a kind of global response to the distribution of research resources. Okay, fourth feature about this particular pandemic is that we actually know an extremely small amount about, obviously we know an extremely little amount about the particular virus itself because it's a novel virus. But we also know very little about mitigation strategies. Thank you. And so we ought to know more. So just take the debate about masks, for example, how vitriolic this debate has been and how politicized it's been. This debate actually about the effectiveness of masks for mitigating the spread of respiratory viruses has been around a long time. 20 years ago, people were arguing about, do we need N95 masks, or do we need cloth masks for mitigating influenza? And there are all sorts of different kinds of studies available, some randomized trials, but not many, that had null results, animal studies, computer simulations, and so on. We also know extremely little about the harms of social distancing requirements and lockdown policies. Now, in some cases, we can make really well-informed guesses about what the harmful consequences of lockdown policies are going to be. We've already heard some of these mentioned, rightly so. And we ought to have a lot more evidence about that. And clearly, one kind of mitigation strategy is social distancing and lockdown. And so we ought to have really good evidence about what it's like to live in social isolation for 6 months or 1 year or 2 years, for example. Okay, we can reuse what we learned. This is sort of obvious because we're talking about science, but because this is a particular pandemic, particular virus, but we will be able to reuse the kind of knowledge that we gain in a concerted effort. And so that should motivate some like contemporary concerted effort. We can learn more. So the emphasis here is we can learn more. What I mean is, if we want to know, for example, does closing elementary schools mitigate the spread of COVID-19? That's an empirical question which we can actually study. So we don't need to make just kind of like speculative guesses about like closing elementary schools, or should university students be allowed in their dormitories? Should pubs close at 8 p.m. or 10 p.m.? These are just highly speculative guesses that policymakers are toying around with and in fact implementing. And we can study these kinds of questions. We can study like what effect does like restaurant closure have on the mitigation of a respiratory virus, and we ought to study it. How? Through, well, this is itself a controversial epistemological question, but one natural answer is via randomized trials. So, there's a big debate about what kind of evidence we need to test a causal hypothesis, to test the effectiveness of some kind of intervention in medicine and in social policy more generally. One answer, which has been very popular for a couple of generations, has been run a randomized trial. And in fact, we can run randomized trials. So during the early stages of an outbreak, it would be good to know if closing schools helps, or closing restaurants. And if closing schools and closing restaurants doesn't help, then that can guide like later stages of the pandemic in useful ways. Okay, it looks like we've heard some gestures towards this in the last few talks, that research resources are not optimized for COVID. So this is this data comes from today. There have been, more than 1,600 registered drug trials testing pharmaceuticals on COVID, and a vast number of these are all testing like the same small handful number of drugs. The line on the bottom, BESSI, these are like behavioral, environmental, and social studies of interventions. And there have been not so many of those. And I'm going to come back to this BESSI movement in just a moment. So we heard just a few moments ago that, and I think this point is right, that if there was a better organization of research resources, we would be able to maximally optimize the hunt for effective interventions. The response to COVID has been reactive. It's been putting out fires. So what I mean is, now we really want to know, do masks mitigate the spread of respiratory viruses? I mean, we, the royal we. Of course, it's been an important question among healthcare workers for many decades. But now, like we, the royal we, really want to know. And this is true for many features of COVID. And what I want to suggest is that we should organize pandemic science such that we're proactive, such that we're devoting a lot more resources to studying the various kinds of important questions that will inform us about the next pandemic. Okay, so we've got these 8 features. I mean, I'm sure there's many more. I just kind of pulled these out of a hat, basically. And what does that suggest? It suggests to me that we should have some kind of Manhattan Project approach to COVID, and to future pandemics. Manhattan Project, of course, was nationally bounded, so maybe the Human Genome Project is a better example. So some kind of global scientific effort to crack some problem. Here's just one, this is like a first step towards that sort of idea that you guys can go to the website, behavioral, environmental, social, and systems interventions for pandemic preparedness. This is just a group of, this is a small group. This is like currently like a very small organization that just has a few epidemiologists, evidence-based medicine type people who try to provide some guidance on what kinds of questions should be asked and how to actually go about answering those questions in collaboration with like governments at different scales. Okay, so if we step back and we ask, like, when the next global pandemic comes, what are the kinds of things that we want to know? These questions are pretty straightforward. We want to know what the R value is. We want to know what the case fatality rate is. As we heard from Ralph, we want to have standardized definitions of case attribution and death attribution, cause of death. We want to know demographic features, like how does age and race and sex interact with these various parameters. We want to know what the symptoms are. And we want to know, like, we want to have really early trials, even if they're small trials, on the effectiveness of interventions for those symptoms. Socially, we want to know the effectiveness of mitigation strategies, like does closing schools help? Does keeping people at home help? So we should have study plans ready to roll out that are really well thought through, and that thinking through could take, I'm just speculating now, but that thinking through could take a lot of planning and effort and buy-in from all sorts of different political jurisdictions. We want to know the immune responsiveness. We want to know, also we want to know some philosophical questions. Like COVID, one interesting thing about COVID is that there's been this intergenerational issue. So it looks like the vast majority of morbidity occurs in people around the age of 80. And the vast majority of social cost that's borne are people in their middle ages or early to middle ages. And so that creates this kind of intergenerational equity question. There's also like a socioeconomic equity question. Like one of the really important arguments that's been made during COVID is the mitigation strategies that might work for Europe have been rolled out in the global South, but are less effective and more harmful in the global South. Okay, very briefly, very briefly, that was all about pandemic science, but I think those issues, so to have that kind of Manhattan Project, this kind of global Manhattan Project where those kinds of questions are being answered, might also go some way towards addressing some of the sort of worries that we've heard, not just today, but in the kind of the work of people like Manuela and Sergio. So, for example, we know that some diseases like malaria are neglected. And we know that the current way in which funding of medical research, the vast majority of medical research is organized, creates conflicts of interest. And those conflicts of interest create what Sergio referred to as industry bias. And so one obvious way to mitigate both of those huge problems would be to have some kind of organization of medical research, which is a kind of Human Genome Project style, large scale, well-funded, independent of industry. Well, Human Genome Project wasn't exactly, but the actual testing of interventions and mitigation strategies would be independent of industry. And that would be on an ongoing basis, both for pandemics, of course, but many people are arguing now that kind of testing or that kind of experimental regime in medicine ought to be much more general than just about pandemics. So I'll just end there. Thanks.